Let me talk about health care, since it's fresh on my mind. The objective has got to be to make sure America is the best place in the world to get health care, that we're the most innovative country, that we encourage doctors to stay in practice, that we are robust in the funding of research, and that patients get good quality care at a reasonable cost. The immediate goal is to make sure there are more people on private insurance plans. I mean, people have access to health care in America. After all, just go to an emergency room. The question is, will we be wise about how we pay for health care? And I believe the best way to do so is to enable more people to have private insurance. And the reason I emphasize private insurance, the best health care plans, best health care policy is one that emphasizes private health. In other words, the opposite of that would be government control of health care. And there's a debate in Washington, D.C. over this. It's going to be manifested here shortly by whether or not we ought to expand what's called S-CHIP. S-CHIP was a program designed to help poor children get insurance. I'm for it. It came in when I was the governor of Texas. I supported that. But now there are plans to expand S-CHIP to include families. Some proposals are families making up to $80,000 a year. In other words, the program is going beyond the initial intent of helping poor children. It's now aiming at encouraging more people to get on government health care. That's what that is. It's a way to encourage people to transfer from the private sector to government health care plans. My position is we ought to help the poor, and we do through Medicaid. My position is we ought to have a modern medical system for the seniors, and we do through Medicare. But I strongly object to the government providing incentives for people to leave private medicine, private health care, to the public sector. And I think it's wrong, and I think it's a mistake. And therefore, I will resist Congress's attempt. I'll resist Congress's attempt to federalize medicine. I mean, think of it this way. They're going to increase the number of folks eligible through S-CHIP. Some want to lower the age for Medicare. And then all of a sudden you begin to see I wouldn't call it a plot, just a strategy to get more people to be a part of a federalization of health care. In my judgment, that would lead to not better medicine, but worse medicine. It would lead to not more innovation, but less innovation. And so, but you got to be for something in Washington. You can't be against the federalization. You got to be for a plan that enhances the relationship between doctor and patient, and that's what I'm for. Here's what I believe in. One, I believe in health savings accounts as an alternative to the federalization of medicine. It gives people the opportunity to save tax-free for routine medical costs, and at the same time have a catastrophic health care plan to back them up. I like the idea of people making decisions that will one, enhance their health, and two, save money. The doc told me that we were looking at one of the brilliant heart guys working for him. You're not going to believe the technology in this hospital, by the way. If you're a Cleveland resident, you ought to be proud of this hospital. It's unbelievable. He said something pretty wise, though. He said, you can have all the technology that man can conceivably create, but if you continue to smoke, we're going backwards. If you're not exercising, if you're not taking care of the body yourself, all the technology isn't going to save your life. Now, there's a certain responsibility that we have as citizens to take care of ourselves. And a health savings account actually provides a financial incentive for you to do that. I believe in plans that enable small businesses to congregate across jurisdictional lines so they can afford insurance, afford spreading risk, just the way big corporations can do. In other words, one way to control costs is to enable small businesses, many of which are having trouble affording insurance, to pool risk. I'm a strong believer in medical liability reform. We've got a legal system which is driving up the cost of medicine because docs are practicing defensive medicine and driving good doctors out of practice. And it makes no sense to have a legal system that punishes good medicine. And therefore, I strongly believe that the Congress ought to pass federal medical liability insurance for our doctors and our providers. I believe in information technology. The first time I came to Cleveland Clinic, we were talking about how to modernize our hospitals, systems, and our doctors' offices into the 21st century. Perhaps the best way to describe the problem is we got too many doctors still writing out prescriptions by hand. Most of them can't write to begin with. And then they pass the file from one person to the next. That's inefficient in this new era. I mean, technology is changing the way we live. It ought to be changing the way medicine operates, and it is at Cleveland Clinic. I envision the day one day when all of us will have our own medical electronic record that will be safe from snoopers. In other words, will be private, but will make health care more efficient. Cleveland Clinic did something interesting. I went to 4 different stations, and after every station, they gave me an outcomes book. In other words, we're willing to be measured, says the good doc. There ought to be transparency in medicine. How many of you have ever actually tried to price a medical service? Probably not many. How many of you ever said, gosh, I wonder whether this health care quality is better than the neighbors? I doubt many of you have done that. Why? Because the system is not geared toward that. Somebody else pays your bills. If you really think about it, and you're working, say, for a company in America, and they provide a health care plan for you, there's a third-party payer. Well, if somebody else pays the bills, why do you care what the cost is at the time of purchase? In other words, the whole plan has got to be to bring more accountability into health care, to make the consumer more responsible for making proper and rational decisions. That's what accountability does. And I applaud you for that, Doc. That's what transparency and pricing means. In other words, you'll be able to shop for price. But the system, by the way, the tax system does not enable the individual to be incented to buy insurance in the private sector. If you work for a company and you get insurance, you get a good tax benefit. If you're an individual and buy insurance, you don't get the same tax benefit. That doesn't make any sense. The tax code needs to be reformed. The tax code ought to treat everybody equally when it comes to health care. And therefore, one proposal, one way to deal with that is something I talked to the Congress about and said if you're a married person and you're working, you ought to get a $15,000 deduction, just like a mortgage deduction, from your income, whether you're working for corporate America or you're working on your own, whether you're working for a small business owner or you're looking for a job. And that way, you begin to make sure the tax code is a level playing field. And that way, an individual market begins to grow because you have got an incentive at that point in time to go out and purchase health care. As a matter of fact, you won't get your deduction unless you purchase health care if you're in the individual market. The whole point I'm trying to make is there's an alternative to the federalization of health care.
President Bush talking about his plans for health care to a group of people in Cleveland, Ohio today. Our Super Tuesday, all politics all the time here on MSNBC today, is going to continue after a quick break. Tucker's up next, but we do have some